examination for the elbow, upper arm, shoulder, thoracic lumbar, and the hip joint. So for the elbow, check for the elbow joint. So the prominence here is the olecranon process. So this is our lateral epicondyle, the side of the thumb. Remember that the anatopic position is this way. So anything at the side of the thumb is lateral, and then here inside is the medial. So this is lateral epicondyle, and here is medial epicondyle. Okay, then we are going to check for the olecranon bursa, which is the spaces in between, which is nasa gilid ng olecranon process. So this is our bursa. So check for swelling, check for any tenderness, check for crepitus, warm, nodules. And for the range of motion, flexion, extension, pronation, supination. So it's 4 for the range of motion. Then we have to check for the upper arm. So we have the biceps and the triceps. Okay, so the long bone here is the humerus. Okay, so check for any tenderness, feel if there is any pain, crepitus. So again, check for the skin color again. Check if there's hyperpigmentation and hypopigmentation, lesions, and masses. So again, for the elbow joint po pala, we have to measure symmetrical points above and below the joint. So we have to use reference point, antecubital fossa using 2 inch above and 2 inches below. So 2 inches above, check for the symmetrical circumference. Then for my patient, he has around 11 inch. So 2 inch below again. Then measure the circumference. For my patient, he has 11 inch. Okay. So remember to measure symmetrical points above and below the joint. Next is we have to check for the shoulder joint. Okay. So we may ask the patient to remove his shirt. So check for the shoulder joint, check for the bony landmarks, check for the clavicle, then go laterally. Sa dulo po niyan is we have the acromioclavicular joint. Okay. The other side, the acromioclavicular joint. And then check for the muscle of the patient. Check for the greater tuberosity of the humerus. Check for the scapula here, the both sides. Okay, check for the landmarks. Always ask the patient if there's any pain in the shoulder joint. Okay, check if there's no swelling. Check for any tenderness. Check if there's no warmth. Check if there's no crepitus, any masses. And then for the range of motion for the shoulder joint, we may ask the patient to stand up again, then do flexion, extension, hyperextension at the back, and then abduction away from the center, and then pabalik, abduction, and then internal rotation and external rotation. Okay, we may ask the patient again to sit down. Okay, then we do now check for the spine. So we may ask the patient again to stand the sideboard. So check for the back. So it should be in the midline. And then we may ask the patient to flex the neck. Check for the prominent bone, which is the C7 here. And then palpate the mid-spinal area. Okay, so check for the spinous processes if it is okay. If there's pain, then check for the paravertebral muscles, which is the keel of the spine. Check for any pain. Okay, then now check for the alignment of the spine. So it should be in the midline. If there's any lateral deviation of the spine, that is what we call scoliosis. Okay, so that's from the back. From the side, check for the curvature of the spine. It should be concave, convex, concave. So if there's posterior deviation of the thoracic spine, so this is cervical, thoracic, and the lumbar. If there's posterior deviation of the thoracic spine, that is what we call kyphosis. Okay? So what for the anterior deviation of the lumbar spine naman, that is what we call lordosis. So we should maintain this angle. We have concave, convex, concave. Now we do the range of motion on the different spines. So we have to check for the baba sa dibdib, then for sa likod, then baba sa kanang balikat, sa kaliwa, tenga sa kanang balikat, and then on the side, and then check for the full range of motion of the flexion, extension, lateral deviation to the right and to the left, or lateral bending to the right and to the left, and rotation to the right and rotation to the left. So for the thoracic and for the lumbar spine, bend forward, flexion, then extension, and then patagilid, lateral bending to the right and to the left, and then rotation to the right and rotation to the left. So that is for your thoracolumbar spine.